Nanotubes are a fantastic solution for the current market. Fantastic because it is made of ceramic, meaning it is transparent, the color of the tooth. And it has a fantastic concept, which is the following. Imagine being able to have an accessory that has the dimensions of the slot you need, meaning it is quite small, simple, but it allows you to perform all alignment and leveling movements just like a bracket, only it is extremely reduced and aesthetic. So, in what situations does a nanotube fit? The nanotube, thinking about aligners for example, we can work with nanotubes in tracking loss. It is fantastic for that, fantastic. You can have tracking loss from extrusion, which is very common, especially in the anterior region, in a lateral, in a central, that does not follow the tracking. Instead of doing what is usual today in mechanics with aligners, which is called bootstrap, gluing a button buccally, gluing a button lingually, and passing an elastic, that makes it difficult for the patient and creates an unsightly accessory. We can work by making a discrete cut at the cervical of the aligner. Since it is very small, we can position them close to the cervical and work with a nitinol wire, for example, to perform this extrusion, this rotation that did not happen, or even an angulation that did not occur. It is extremely practical. It has an 18 gauge round slot, meaning you will not work with rectangular wire. And you can work with gauges from 0.10 to 0.18, which is more than sufficient to promote rotations, angulations, extrusion and intrusion in your teeth. So sometimes we will work with 3 or 4 tubes to make small movements with the aligners. So this is a fantastic solution that practically does not exist in the market. Now, there is another condition where we will also use the nanotubes. For example, premolar or even a molar that is excessively lingualized, it can be upper or lower. And you cannot bond the accessory due to the vertical overlap that exists on that tooth, causing collision, meaning there is no vertical space to bond the accessory. The nanotube allows you, even if you are using brackets throughout the mouth, to bond this nanotube and thread the wire, bringing that tooth from the lingual position to align it in the arch, and then you can replace the accessory. Remove the nanotube and place a bracket there. So it is a fantastic solution. Before we used to do this with stops and applying resin, a quite difficult and complex situation in practice. Now we have a nanotube that comes in a fantastic blister that you can pick up with a proper tweezers. It has a very good grip with the tweezers. You can apply pressure on it during bonding, which is extremely important. Otherwise, it will be loose. We can position it properly, and we have a great practicality with this accessory, which was extensively designed for its mechanics and also for its placement in your patient's mouth. So it is a fantastic accessory that adds value because it is something different and new that makes life easier for the orthodontist and also for the patient, especially those who are very concerned with aesthetics, particularly patients with aligners. Today, you have a resource that will be temporary, just to recover, tracking to solve a problem that was previously complex. Very good. An accessory that I am absolutely sure you will love.